Hello, my name is Ahmed Elghawy. I'm one of the recent graduates from the University Hospital's Primary Care Sports Medicine Fellowship Program, and I want to spend just a couple of minutes discussing with you some of my thoughts and experiences with the program and some of the things maybe you should consider when you're applying this summer. I think the most important thing for me when I was applying was coverage, and at University Hospital I think we have some of the best coverage in the country. Every fellow is given their own high school to cover, and then we all share coverage in Division 1, 2, and 3 college athletics. We get to cover a semi-professional hockey team, the Cleveland Monsters, with one of our dual-trained attendings in emergency medicine and in sports medicine. And then we get to dip our toes in professional NFL coverage with the Cleveland Browns. I think on top of that, we have a very strong didactics program with weekly didactics that covers very important issues that happen in the clinic and on the field. We cover journal clubs that help keep the talks academic and helps us consider some of the new therapies and new guidelines that are naturally evolving throughout the field. And we also have weekly didactics in musculoskeletal ultrasound with Dr. Flannery, where once a week we kind of break down a body part, look at it from an anatomical perspective, and then it helps us appreciate some of the pathology that we see in the clinic when we're doing therapeutic procedures. One of my biggest worries when I went into fellowship was I'm an internal medicine trained physician, and that I was not going to get enough pediatrics training. And I think that all kind of went away when I started, because I was able to work with some of the best pediatric attendings that I've ever worked with, and that kind of speaks for the whole department, because whether you're internal medicine trained, you're a pediatrician, family medicine, PM&R, or emergency, you're going to get a very well-rounded experience. I was able to work several days a week with every kind of attending and get the most out of it, and so now I feel very comfortable treating pediatric injuries. I feel very comfortable with fracture care. I feel very comfortable with concussion care. And so I think that speaks very highly of the department. And from the other perspective, from the adult perspective, we work very heavily with non-surgical orthopedics and doing a lot of MSK ultrasound-guided procedures. Apart from the core faculty that we work with on a daily basis, we do electives, and these electives change once a month, and so we spend anywhere between a half day or a full day a week with different types of attendings that give us a more complete experience, whether that is in hand and wrist orthopedics or shoulder orthopedics or physical therapy or nutrition. It gives us a more well-rounded experience that we can take that information and pass it on to our patients. If you want to go in the OR and see the type of surgery that you're recommending to your patient, you have that option to do so. And so this fellowship lets you kind of build a very individualized experience and see what you need to become the best sports medicine doc you can be, and our attendings are there all the way supporting that. And so I can't speak highly enough about the program. I think that if you want more information, you should reach out to Dr. Briskin. I think she's a wealth of information, a wealth of knowledge. If you have any questions specifically about this testimonial, I'll make sure that Dr. Briskin reaches out to me and puts us in contact. But I think the most important thing is to just enjoy the ride. Fellowship is a really fun time, and if you have any questions, let us know.